Welcome to our presentation on Ethics in Healthcare, Part 1 of 2, Awareness, brought to you by Surge Learning. This module consists of 2 parts. Part 1 will cover foundation knowledge and awareness, definitions, and the overview of an ethical framework, while Part 2 will use the ethical framework to work through case studies. It is hoped that you will also take this time to reflect on your learning and set goals to learn more and feel confident about ethics in healthcare. You likely face an ethical situation every autumn during flu season with your workplace influenza program. You may not agree with influenza immunization and do not feel it is right, or maybe even legal, to have a flu shot. At the very least, this presents an ethical dilemma for you. Choose from the options below: unfair, illegal, or an ethical dilemma. Correct. Depending upon where you work, there may be occasions where clients return to their own homes. Sometimes you worry that this is unsafe and may result in harm or risk for the individual. So much so that you feel someone needs to step in and do what is best for the client and provide alternative living arrangements. This often results in conflict as the client is capable and has the right to risk. Correct. Before we consider if something is an ethical dilemma, we need to ensure we follow legal guidelines first. In this case, John is capable of making his own decisions, and based on law, he may do so. For those of you who work in long-term care, you have met amazing families who have been caring for their loved ones for years and have desires for the care routine that they have been providing to be continued. This may mean very specific diets, taking 60 to 90 minutes to assist their loved one at meals or toileting them every 30 to 45 minutes to keep them continent. Your resources, combined with trying to be fair to everyone, means that you are unable to carry on with this routine. Before admission, do you tell that to the families who are stressed and burned out? Or do you let time and discussions after admission take its course? There are pros and cons to both. There may also be legal requirements. Correct. In this case, there is also law about informed consent, so legally the team must disclose this information before admission. Life and death situations and the necessary decisions that need to be made are often discussed by the family for the first time at the point when the decision is imminent, like an emergency trip to hospital. Families may not agree on the course of action, and ethical dilemmas result because there may be more than one right choice. How is this decided? An ethical framework or decision tree will be used to assist the family and the team to make a decision. Palliative care is an area of practice where there are frequent ethical dilemmas. This can be more complicated when there is a child or young person involved, as we expect older adults to die, yet feel something is not right when children die. Decisions made by parents sometimes make staff feel uncomfortable because those decisions differ from the staff members' values. It can become quite emotional. The staff need to consider if there is additional information that the parents have about their child that led to their making this decision. Part of working through this ethical dilemma is to ensure that all available information and resources have been investigated and the decision is in the best interest of the child. The situations presented here are examples of what may happen in your workplace. You may be wondering, how do I manage this and do a good job? I worry about making the right decision. I don't understand enough about ethics. So, let's learn some more. Ethics in Healthcare. Knowledge. You may wonder about the definition of ethics. Is it a moral compass? Is it applying the law to a situation? Is it about my personal, cultural, or religious values? Morals are defined as principles of right or wrong based on personal values. Sorrentino, page 140. Your morals and values may be influenced by your culture, religion, family, society, and community. Sometimes morals change over time, and what was immoral 100 years ago may be acceptable now. Values may also differ between cultures. Some cultures value the decision-making of the oldest male in the family, while others would disagree with this. Both are right for that family, and we cannot impose our value system on others. Ethics is defined as a careful and systematic reflection and analysis about moral ideas and how they affect practical issues. Yeo, page 30. For example, a 16-year-old refuses more chemotherapy and will die sooner as a result. Who makes this decision? The child? The oldest male? The parents? The care team? All options have pros and cons, and therefore there is an ethical dilemma. An ethical dilemma is when there is a conflict or disagreement between more than one care option. An ethicist is a professional with expertise in ethical principles and often consults with the healthcare team around ethical dilemmas to help them decide. A framework or decision tree is often used to ensure all points are considered. We need to pause here and understand that ethics is not about the law. An ethical team will ensure that the law is followed, but even with law there is sometimes more than one choice to consider. For example, a son or daughter may be concerned about an aging parent. The adult child may be thinking ahead about risk and would like to avoid it by providing more assistance for their parent, such as a change in living arrangements. The older person, who is managing just fine right now and is capable of making his or her own decisions, decides against this idea even though the risks are understood. The son or daughter is insistent, saying, "If you fall and break a hip, you could be lying here for days. I have POA and I'm making this decision for you." Is this an ethical or legal decision? Incorrect. This is a legal situation. The law says that the client is capable of giving or refusing consent. The child may not agree and there may be family conflict, but the law is clear. In this case, some counseling support for the family may help. As we examine situations, it is also important to know that ethical decision-making will not always result in one right answer. It does result in carefully reviewed options from which to choose. Each situation is individual and often requires a team effort. This team may include healthcare providers and subject matter experts. For example, a palliative care expert would be consulted for end-of-life decisions, whereas an ethicist may assist with resource allocation. Who gets the only ICU bed? First patient seen, or the youngest, or the most critical, or the one most likely to survive? You have had a great deal to think about up to this point. You might be thinking, so why is this important? As healthcare providers, we always want to do a good job and do so in a way that is fair to all the clients we care for. We want to support our clients in a way that promotes their dignity and self-worth and encourage them to be as independent as possible. As you know, this is not always easy. It is not always black and white, and you may feel distressed about some choices and decisions. This awareness of ethics and the framework will assist you in doing a good job and feeling good about it. Ethics in Healthcare. Knowledge. Ethical principles. To make ethical decisions, experts have determined 4 basic principles that are common to society: autonomy, beneficence, non-maleficence, and justice. Autonomy means to be able to make decisions for ourselves about what is best for us. This places an emphasis on individuality and client rights. It has a basis in law, including the law about informed consent, which means that a client must be given all of the necessary information with which to make a decision. The provided information must be unbiased so as not to coerce or persuade the client into making a decision that suits the care provider or family. Consider this situation. Elsa lives alone and manages well. Pneumonia, an acute situation, has resulted in a hospital admission. Due to her infection and relocation, she has some temporary delirium and is confused. Her son, worried about his mom, makes the decision that he feels is best, which is admission to LTC. He makes this decision as her POA. Is this an example of Elsa's autonomous decision-making? Correct. Elsa needs to have an opportunity to get better and make her own decision. Beneficence is a word based on benefit or to promote good. Consider this. Susan has stage 4 breast cancer. She has undergone 4 years of surgery, chemo, and radiation, and is fully aware of the effects of these treatments. She has been offered an experimental chemo with the hope of prolonging her life. This chemo has devastating side effects that will impact on her quality of life. Susan struggles with quality versus quantity. In this case, does the chemo promote good? Good choice. This is a dilemma. The chemo may give her more time with her family, and this is good. However, if she is so sick that this time is actually heart-wrenching, then maybe it is not good. In this case, Susan may make an autonomous decision that works for her. Non-maleficence means that we should not engage in care activities that do harm. For example, we know that there are strict research guidelines to be sure that participants in a research study are not unduly harmed. Another example is CPR. In long-term care and in palliative care, the question of CPR comes up and whether it is effective or harmful. Simrit is 99 years old, and her family is looking forward to her 100th birthday celebration. She is admitted to ICU with significant heart failure and not expected to survive the night. Her family wishes for extraordinary measures to prolong her life. Her healthcare team feels these measures will cause excessive harm and pain without reasonable hope of benefit. How will informed decision-making help with this ethical dilemma? The family loves Simrit, and everyone, including Simrit, was looking forward to more time together. What's wrong with CPR? An informed family would need to know that CPR is only helpful when the heart and lungs are otherwise healthy enough to recover, that the act of performing CPR causes pain and in frail older people usually results in a fractured sternum and ribs, which can puncture vital organs, causing further damage and death. The likelihood of survival after this painful procedure is low to none. And finally, ask themselves, is this how Simrit would want to die? The team has a responsibility to ensure the family has all of the information they need to understand the outcomes of the decision. Justice means that the decision is fair and equitable. A simple example is a healthcare provider bringing in a coffee for a resident with whom they have grown attached. This is great for that resident. Others want the same for them. Now there is a problem with what you do for one, you need to do for others. This is not possible. In healthcare, we have issues of fair and equitable all the time. People may wait 6 months for a joint replacement and find someone in another area will get one in 3 months. Others may wait several weeks for public system physiotherapy, whereas someone with a benefit plan or income may pay for it and get access immediately. Those living in more remote areas do not have the physical access to resources that others have. You may find you are spending more time with one client than another because of differing care needs. You may feel confused about the fairness of all of this. There is no easy answer to these questions, but they are good to ask. We must always ask these questions and work to ensure that we are fair. You have learned about the 4 basic principles, and you have touched on some scenarios that you may encounter. You may still find yourself questioning your knowledge of ethics and how to use it in your practice. Your organization will likely have a decision-making framework that they use when faced with an ethical dilemma. It will include a decision tree that first identifies that you have an ethical dilemma rather than a legal decision. You have considered the 4 principles: autonomy, beneficence, non-maleficence, and justice. After which, you will come up with one or more possible options and consider the pros and cons of those options, which will lead to a final decision. This process is not easy, and there will be many consultations to consider all aspects. This may include looking at similar examples and bringing in experts. Each organization is different, and your ethical framework will be modified to be unique to you. We now invite you to take Part 2 of Ethics in Healthcare. In that section, you will use this framework to work through the ethical dilemmas we presented to you at the beginning of this module. Thank you for joining us today for Ethics in Healthcare Part 1 of 2. This presentation has been brought to you by Surge Learning. Welcome to Ethics in Healthcare Part 2 of 2, the application of the ethical framework, brought to you by Surge Learning. Before we begin, let's quickly review the framework that was introduced in Part 1. How many can you remember? If you recalled autonomy, beneficence, non-maleficence, and justice, you would be correct. Your organization will likely have a decision-making framework that they use when faced with an ethical dilemma. It will include a decision tree that first identifies that you have an ethical dilemma rather than a legal decision. You have considered the 4 principles: autonomy, beneficence, non-maleficence, and justice. After which, you will come up with one or more possible options and consider the pros and cons of those options, which will lead to a final decision. This process is not easy, and there will be many consultations to consider all aspects. This may include looking at similar examples and bringing in experts. We introduced several scenarios in Part 1. Let's practice solving them using these principles and framework. Scenario 1. Flu shot. You do not believe in the flu shot. There are workplace policies about immunization that you do not agree with. You refuse to have the immunization. In this case, the 2 options are: do not take the flu shot. Do take the flu shot. Let's apply the 4 principles to this situation. Included here are the ethical 4 principles of autonomy, beneficence, non-maleficence, and justice. Consider the questions and click on yes or no. Autonomy. Do you have the right to make your own informed decision? Correct. You do have the right to make this decision. Be sure you are informed of all the possible outcomes. Beneficence. Will the outcome be beneficial to both you and others? Both correct and incorrect. You may personally feel well and have no untoward effects. Those around you may be exposed to influenza, however, and this is not beneficial to them. If you get influenza, it is not beneficial to you. Non-maleficence. Is there a possibility of harm for you and others if you do not take the flu shot? Both correct and incorrect. No harm from possible side effects of the medication will affect you. If you or others get influenza, there may be harm that in some cases could be life-threatening. Justice. We are part of a community. Is the right to make this decision fair to everyone? Both correct and incorrect. Everyone has the right to make this same decision for themselves. The policy is applied equally. However, those who wish for a more comprehensive protection for themselves and others may feel that this jeopardizes their safety. Keeping the principles in mind, jot down as many pros and cons that you can think of related to the option of not taking the flu shot. There is no right or wrong answer. Here are some pros and cons that may be similar to yours. You may also have more. The possible pros. I am able to make an autonomous decision. I will not have any short-term or long-term side effects from the vaccine. Others can make the same decision. The possible cons. Possible increased exposure of influenza for self and others. Influenza will make me feel very unwell and I will not be able to carry out my daily activities. Influenza may result in severe illness or death for immune-compromised individuals. If you decide to take the flu shot, then your pros and cons will be opposite of the decision to not take the flu shot. Given all of this information, what possible solution could you come up with that meets the needs of the individual and the group? This policy may be very similar to the one in your organization. Essentially, your individual right to take or refuse the flu shot is respected. How this decision will affect others is also respected by requiring non-immunized staff to remain off work or to take antiviral medication. You may still feel this is not right, but we must consider others because we live in an ethical community. If your child were undergoing chemotherapy and at a high risk of dying from infection, you appreciate that those around you do not bring influenza into your home. Scenario 2. At home, at risk. John is discharged from hospital. The social worker feels that he is unsafe at home, yet he insists. Some people find he is eccentric, yet he is capable. Should the team require that he live elsewhere where he will be safer? As before, read the questions and click on Yes or No. Autonomy. Does John have the right to live at risk? Correct. John needs to be informed of all the risks and benefits of his decision and offered different supports. Beneficence. Will the outcome be beneficial for John? Both correct and incorrect. John may feel the benefits of doing his own thing his way outweighs any risk. For example, you know the risks of too much fast food, yet you decide to have this diet anyway, and you have the right to do so, even though your future health may be in jeopardy. Non-maleficence. Is there a possibility of harm for John? Both correct and incorrect. Physically, he may fall or not eat well. Emotionally, he may be happier, and for him, this is best. Justice. Is there a concern that the decision is fair and equitable? Incorrect. This is a decision that affects this individual only. Justice may come into place if the care team does not apply the same criteria to all discharges. Write the possible options that you think the care team has for John. To work through this scenario, you may consider these 2 or 3 options. 1. Send John home and, with his consent, offer support services and options to reassess. 2. Determine if you need the assistance of the public guardian, as John is at risk of harm to himself. 3. Keep John as an inpatient for a while longer and try to persuade him to move to assisted living. You may have come up with these options or some others. This activity demonstrates that these decisions are not easy and take time to discuss and consider all of the pros and cons. There is no right or wrong option here. If you are thinking and problem solving, that's great. Using any option you wish, work through the pros and cons of the option, recording your answer here. Remember, there is no right or wrong. Here are some possible solutions based on the 4 principles. Autonomy. John is capable and he decides to go home. Beneficence. You support his informed decision. Non-maleficence. You provide as much support as he allows. Justice. You treat John the same way you will treat all of your clients who are being discharged. Scenario 3. Admission to long-term care. A client is being admitted to your LTC home. His wife has kept him continent by toileting Q30 minutes. You know that with your resources you cannot manage this. In advance of his admission, should you advise her that you cannot meet this need? In this scenario, we will dialogue about the pros and cons of telling the client's spouse before admission that you cannot meet their needs. One staff member, the DOC, says we should tell the spouse. The other staff member, the social worker, is concerned she is not emotionally ready to hear this and to delay it until after admission. You may wish to jot your thoughts down as we progress through this dialogue. Mrs. Witherspoon has a huge wish list here, from what he eats to when he eats to how he eats, to massaging his hands, reading books to him, taking him to the bathroom every 30 minutes, playing music at certain times of day, when he naps, for how long. I could go on, but clearly we cannot do this. I need to discuss this with her before she decides on admission.
I hear what you're saying, but CCAC and her family physician are very concerned about her. She's already had 2 admissions to emerge for TIAs, and at one point she was so frustrated they thought she would hit her husband. I'm afraid if we tell her she won't admit him, and the situation at home will go from bad to worse. I think we admit him, and gradually get her used to a change in his routine.
What did you learn about ethical decision-making during this dialogue? Check all that apply. Incorrect. Scenario 4. End-of-life decision. Mr. Z, 92 years old, has been sent to emergency in cardiac crisis. His wishes are not known. His daughter says everything must be done. His son says he should be comfortable and let nature take its course. You have practiced applying the framework to scenarios. In life, things can get complicated and answers are not so clear. The ethical decision-making in this case has many things to consider. Write down all of the things that you think will be discussed by the team and the family. There is no right or wrong answer. You have come up with many variables to consider. Some may be included in the list below, and you may have more that have not been included. Compare your list with this one. Is there a living will? Who is POA for personal care? Do we know the patient's wishes? Are there cultural or religious values that are important to this decision? What do we hope to achieve by actively doing life-saving measures, such as CPR? This is a sudden situation and very emotional. The family has had little time to think. Have we provided all the necessary information with which to make a decision? Have we offered the support of clergy or social work? Sometimes, especially when the need is urgent and we're in a hurry, we make decisions based on incomplete information. Even with a framework, a team will need to do some data gathering in order to have all of the information that they will need. Which one of the following 3 points would be the most essential for the team to have, as it influences the decision in a major way? Incorrect. We hope that family expresses accurately what the patient wanted, but often we find disagreement between family members. Having a living will would make this easier. In this scenario, we learned, before we can work through an ethical framework, have all of the available data. Check for legal documents. Sometimes the issue is less about ethics and more about following the law and helping a family who is sad and upset work through a difficult situation. Scenario 5. Moral distress. Julie is 17 months old. She has significant developmental and physical delays. She will be admitted to a children's center for respite. In the event of an emergency, her mother has told the staff that her daughter is palliative with a DNR. Some staff members feel uncomfortable with this decision. Moral distress occurs when you do not feel comfortable with the decision made by a client or their family. It is important to distinguish between moral distress and ethical dilemmas. Moral distress is when a decision is contrary to your values. Ethical dilemmas are when there is a more equally compelling choice for the client from which to choose. Here are two examples of situations. One is an ethical dilemma where one is not, yet causes moral distress with staff. Situation 1. Adult refused life-saving blood transfusion due to religion. Situation 2. Parents allow their 14-year-old son to decide about his medical procedures. Drop and drag the situation into the correct category. If you said that the example of blood transfusion was moral distress, you are correct. This autonomous decision, based on having all necessary information, is legal, and an ethical team cannot override this. It may make some individuals feel uncomfortable because it is not consistent with their value system. The situation where the 14-year-old is consenting to medical procedures presents an ethical dilemma. Some 14-year-olds are very capable of making this decision, and their parents are well prepared to support the child to do this in certain situations. The issues are, is the 14-year-old mature enough? Is the treatment significant, and does everyone know the outcomes and consequences? Would making the wrong decision have catastrophic outcomes? Each situation is evaluated on an individual basis. Moral distress, when left unmanaged, can be very stressful and negatively impact on your quality of life. You are encouraged to seek to understand the situation better. For example, do not jump to conclusions about what you think a religion means. Rather, learn more facts and make yourself more knowledgeable. Also, seek support from peers, managers, clergy, counselors, or from your employer's EAP program. This is not unique to you, and sharing with others is beneficial. Today you learned about how to apply an ethical framework, about the importance of having all of the information, an awareness of moral distress, and that ethics takes a team, since it is not easy and clear-cut. Probably you have also learned that there are things you need to know more about. This is a good time to identify your future learning goals and how you will achieve them. Take a moment to write them down and make a plan. Thank you for joining us today for Part 2 of Ethics in Healthcare, Application Framework. This presentation has been brought to you by Surge Learning.
What matters to me is the love and the eye contact and the genuineness of people.
I want them to know who I am, not what disease am I, or what age am I, or how tall am I.
It's important that I can stay with my mom.
What matters to you is about knowing our patients. And you have to have that starting point in order to begin working as a team.
I think it establishes a relationship, and the relationship needs to be one of a partnership.
Those questions get asked in a number of different ways. I might ask, what makes a good day for you? Or what are you most proud of? Or what matters to you? What gives you hope? What gives you courage? And in those conversations then, what matters to them comes out over and over again.
I introduce myself. I go into the room and say, my name is Joe. I'll be your nurse for today.
You need to maintain your eye contact with a smile. Come in gently into the conversation.
It helps when people are friendly.
Congratulations, it's exciting to hear that you're pregnant.
Thank you.
Now, when looking at your prenatal care, you have several options from an obstetrician, a family doctor, or a midwife. In order for you to make that decision about how you want your pregnancy managed, I need to know what matters most to you.
I think because this is my first baby, what matters most to me is having
The bedside whiteboard is probably the best tool if it's a matter of a patient request on how they would like to engage in their care and discharge planning. The bedside whiteboard belongs to the patient and family, should be written in language that they can interpret very easily, and should be reflective of the conversations we're having with our patients.
When we do our huddle, we bring the team, including family, but family is part of the team. So we share stories, then we compare different perspectives. Then we gain a fuller understanding of what's going on.
Most places where residents live have care conferences. We start off our care conferences by asking the resident themselves, what's important to you, what are your concerns, or what would you like to bring forward to the team? The families come to the care conference and they're very good advocates for their loved ones.
Ask my opinion, please.
I don't jump in. I ask open-ended questions. I allow them to share as many, if not all, their feelings and their thoughts so that they can get them all out. Another really important part of listening is to be empathetic and to show compassion.
I think you should just pretend it's your own grandma, grandpa, or your mom.
What I think is really important for doctors, that they have that curiosity and that interest in the patient.
Sometimes when it's delving into that emotional aspect of the patient, we're treading on territory that we may not always be comfortable with, but it's one that needs to be explored in order to truly provide a trusting, caring relationship with your patient.
Often people feel overwhelmed because they feel they have to solve that problem, right? So you're not going in there to solve that problem. You're going there to understand, to listen to that problem.
I understand that your mom had a fall the other day and unfortunately broke her hip.
Yes, it was so, I don't know how she's done it, but she stumbled and fell off the stairs.
Yes, so there are options for you, and one of them would be like surgery, or we could keep her comfortable just with some pain medications. And I'm just wondering what you, being able to speak for your mom, what would she want?
My mom would like to have her life back, so whatever it takes to get her life back to normal.
I want to provide the kind of care that I would like to receive, and I want to give them whatever they need. And if that's a talk, instead of pushing my therapy all the way to the end, then it'll be a talk sometimes. If they're maybe just angry that they don't have a toothbrush, then I might just go get one.
Perhaps the client themselves used to be a very active person, so we provide that person with as much opportunity for them to be active.
An idea of something I thought would be fun for my husband and I to do. He had dementia. I called it a spousal sleepover, and she was happy to go to her administration in Vancouver and talk to them, and finally it happened. And he liked those, and I did too.
Shift reports and care plans are constantly being updated to ensure that the care is consistent with our clients. Lots of verbal communication between team members is also essential.
I think that we are at a juncture where we have the opportunity to really change the way that we do things within our health and care services, and to change the way we are as a society, learning from some of those lessons or some of those changes that have taken place. You know, as I say, the times were dark before. The pandemic has been a very dark time.
Welcome to a presentation on the Excellent Care for All Act. This presentation has been brought to you by Surge Learning. The Excellent Care for All Act, which came into law in June of 2010, puts Ontario patients first by strengthening the healthcare sector's organizational focus and accountability to deliver high-quality patient care. The Excellent Care for All Act defines quality for the healthcare sector and reinforces shared responsibility for quality of care. It is based on strategic directions that exemplify good governance and high-quality patient care. It also builds and supports boards' capability to oversee the delivery of high-quality care and ensures that organizations make information on their commitment to quality publicly available. The legislation sets out a number of requirements for healthcare providers, which will be implemented first in the hospital sector, with the intent to expand across all healthcare organizations in the province. The legislation requires that healthcare providers establish quality committees that report on quality-related issues. They must put annual quality improvement plans in place and make these available to the public. Healthcare providers must also link executive compensation to the achievement of targets set out in the Quality Improvement Plan. They must put patient and care provider satisfaction surveys in place, as well as conduct staff surveys. Healthcare providers must also develop a declaration of values following public consultation if such a document is not currently in place. Finally, healthcare providers must establish a patient relations process to address and improve the patient experience. Section 3 and 4 of the Excellent Healthcare for All Act 2010 focuses on quality committees. Every healthcare organization needs to establish and maintain a quality committee for their organization. Section 4 of the Act outlines the responsibilities of the Quality Committee. They must monitor and report to the responsible body on quality issues and on the overall quality of services provided in the healthcare organization, with reference to appropriate data. They must also consider and make recommendations to the responsible body regarding quality improvement initiatives and policies. They must ensure that best practices information supported by available scientific evidence is translated into materials that are distributed to employees and persons providing services within the healthcare organization, and to subsequently monitor the use of these materials by these people. They must oversee the preparation of annual quality improvement plans and finally carry out any other responsibilities provided for in the regulations. Section 8 of the Excellent Care for All Act reviews that annually every healthcare organization shall develop a quality improvement plan for the next fiscal year and make the quality improvement plan available to the public. The organization uses tools such as results from surveys, data, and quality indicators to develop their plan for the following year. The annual quality improvement plan must include indication of performance improvement targets, the significance of reaching those targets, as well as what steps or micro-actions need to take place to achieve those targets. When identifying your quality improvement goals, you can use the acronym SMART to help you ensure that you've covered all the bases. Your plan should be specific, measurable, attainable, realistic, and timely. The organization must provide a draft of the plan to the local health integration network prior to making it available to the public. In addition, a copy to the Ontario Health Quality Control Council for the purpose of province-wide comparison. Section 5 of the Excellent Care for All Act reviews the frequency and purpose for carrying out surveys within the healthcare organization. The intent of the survey is to gather information concerning satisfaction with the services provided, as well as satisfaction of those working for the organization. Those individuals who received services within the past 12 months, as well as their caregivers and family members, should be surveyed annually to ensure that they are satisfied with the service that they are receiving. Once every 2 years, employees and those who provide services must be also surveyed to gauge their satisfaction with working with that organization. A well-established patient relations structure and process supported by the right personnel is key to identifying gaps between patient expectations and experiences of care, as well managing perceptions of patient expectations and quality of care. Section 6 of the Excellent Care for All Act refers to the patient relations process. Every healthcare organization must have a patient relations process and make information about that process available to the public. The organization must ensure that the patient relations process reflects the content of its Declaration of Values. Patient relations must be supported by senior leadership and quality committee. The concern resolution process should contain consistent core elements reflecting best practice, and there should be a policy and procedure in place to communicate this. There must also be a process and tool to collect information and a mechanism to monitor the status of concerns. There must be a process for measurement and evaluation with regards to the patient relations process. This includes documenting the method that the feedback was received. This includes types of feedback such as the number of inquiries, concerns, compliments, requests for support from staff, feedback aligned with program, service, and staff group involved, total number of concerns by the type and severity, resolution summary and the outcome, and the resolution time or response time. The healthcare organization must also develop methods to evaluate the effectiveness of the process. They must report regularly to the senior leadership and board quality committee on metrics, trends, critical incidents, and patient stories and recommendations. Finally, they must develop timely process and methods, both written and verbal, for responding to the patients and families. The Patient Declaration of Values refers to fundamental values that the patients want and expect from the healthcare team. In long-term care, the Resident Bill of Rights spells out how residents must be treated with respect and dignity, be involved in decisions, and be free from abuse and neglect. The organization has a responsibility to deliver care, services, and programs based on these core values. Hospitals and other healthcare agencies must involve and consult with patients when developing the Patient Declaration of Values. The organization may amend the Patient Declaration of Values after consultation with the public and must make available to the public the amended values. Section 9 of the Excellent Care for All Act refers to performance-based compensation. Organizations will be expected to strive towards performance improvement in every aspect of implementation. Organizations must develop quality improvement plans annually, and these must be available to the public. Annual quality improvement must consider results from surveys, patient relations, and critical incidents. These plans must include, at a minimum, annual improvement targets and justification for these targets. The plan must also include how the compensation for executives is linked to the improvement targets. If requested by the Local Health Integration Network, the organization must provide a copy of the Quality Improvement Plan. A copy must be submitted to Health Quality Ontario to permit province-wide comparison and reporting of quality indicators. The Excellent Care for All Act is based on strategic directions that exemplify good governance and high-quality patient care. It helps define quality for the healthcare sector and reinforces shared responsibility for quality care. It builds and supports the board's capability to oversee the delivery of high quality of care. It ensures healthcare organizations make information on their commitment to quality publicly available. Thank you for watching this presentation on the Excellent Care for All Act. If you wish to receive more information, you can view the following resources from the Ontario Ministry of Health and Long-Term Care website and the Excellent Care for All Act 2010.